here's an interesting fact. Did you know that the rate of preeclampsia in the U.S. has increased 25% in the last 2 decades? And it's the leading cause of maternal and infant illness and death. That's a pretty alarming increase.
Yeah, that's an amazing number.
That's big. Now, what is preeclampsia and who is more at risk for it?
So preeclampsia is in pregnancy when your blood pressure goes up combined with some other abnormalities. Specifically, we see protein in the urine or other lab abnormalities, specifically problems with your liver or your kidney. The specific criteria have changed a little bit over the years, but that's classically how we define preeclampsia.
And is it true there's usually no symptoms to preeclampsia?
You may not have any symptoms. Again, I'm going to go back to how important that prenatal care is. Yeah, absolutely. Going all those visits, that's traditionally why every visit we will do your blood pressure,
your urine,
and weight. Because retaining all that water, which classically occurs with preeclampsia, you can go from one visit to the next and have a jump in that weight.
Right.
So that's what we do.
So what are you looking for exactly when you do the urine test, the blood pressure, the heart rate, all those things?
Right. So somebody can have a classically elevated blood pressure, 140 over 90, that's the trigger number. But sometimes it could be a little bit more subtle. If somebody has had very low blood pressure for them, their numbers are 90 over 60, and suddenly for them, they're 130 over 85. It might not hit that 140 over 90 criteria, but you see a change. So their blood pressure going up. In the urine, we're classically looking for protein.
Right.
And then the weight. Weight is important. You're always wanting to make sure people aren't gaining too much weight because that's a risk factor for all sorts of health problems.
And let me ask, what is the amount of weight that a pregnant woman should be gaining in her pregnancy?
So classically, we say for the whole pregnancy about 25 to 30 pounds.
25 to 30.
But that varies if you're underweight or overweight at the start of your pregnancy.
Okay.